Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Millions and millions of people visit their primary care doctor every year. It's one of the most important relationships of your life, one that relies on open, honest, two-way communication. So how do you pick a primary care doctor who specializes in your needs? Joining us to talk about this is Dr. Kosha Nathwani. She is a family medicine physician with the Scripps Clinic Medical Group in Encinitas, California. Doctor, thanks so much for being with us.
Thank you for having me.
So talk a little bit more about the role of the primary care doctor.
So, primary care physicians can act as quarterbacks of the medical team. They can order additional testing for you, they can place referrals to specialists, they can place referrals to occupational therapy, physical therapy, and they can also make sure you're up to date with all of your preventative screening testing.
And what are the different types of primary care doctors?
So there are quite a few. Pediatricians can see children. We have OBGYNs that deal primarily with women's health, geriatricians who treat our elderly patients, internal medicine specialists, as well as family medicine doctors who typically see patients of all ages.
So what should you be looking for in a primary care doctor?
So, questions to ask yourself are what type of characteristics would you want to see in a primary care doctor? You want to make sure you feel comfortable speaking to them, opening up to them about your medical concerns and personal issues. You also want to pick someone who you can see yourself building a long lasting relationship with.
So some of the things you might consider would be their gender, their age, language, cultural considerations, where they're located.
Yeah,
Does their schedule fit in with your schedule?
definitely. All of those things are characteristics that you would want to take into consideration.
And what kind of research should you do to see what your doctor specializes in?
Yeah, so you can go to scripps.org and click on Find a Doctor. And when you go there, you're actually able to read all of the biographies of the various primary care providers who we have within Scripps. And a lot of them talk about what their specific interests are, how they like to treat their patients, the philosophy that they have when it comes to treating patients. And that's a great way to choose a provider.
Yeah, and you talk about the doctor's philosophy and culture. Elaborate a little bit more on that.
So, different doctors have different interests and different ways in which they treat their patients. Some doctors prefer to use more of a research based approach, whereas others use a more holistic approach where they can combine Eastern and Western philosophies when it comes to treating their patients.
And so what are the questions you should be asking your primary care doctor?
So, you want to ask them about routine screening tests, including pap smears, colonoscopies, mammograms. You can bring a list of your medications with you to make sure that you're on the right ones, especially the right dosages. Also, any acute medical concerns that you may have, whether it's a cold or a viral illness. I think those are all important questions that you can bring to your doctor.
And is it good for you and your family to have the same doctor? Let's say a husband and wife has the same doctor.
Yes, definitely. So, a lot of physicians do not mind treating families and actually enjoy treating families together. But obviously, it's a personal decision, and that's something you can discuss a little bit more with your doctor.
So what advice do you give new patients to establish care with their primary care doctor?
So I do recommend that all new patients bring with them to their initial appointment a list of their medical conditions, a list of their medications, including the dosages that they take, how often they take the medication. It's important to have an immunization record, including dates. Also, recent health screenings that have been done, such as the dates of their colonoscopies and mammograms, all of those things can help your doctor to tailor your care in the way that's needed for you.
And maybe also any abnormal test results, like or any surgeries or medical procedures that you've undergone.
Exactly.
And then as far as subsequent visits are concerned, many of them can be done actually online, right? You don't have to go into the doctor's office. You can see your primary care doctor from the comfort of your home.
That's right. So if you go to myscripts.org, you can always set up an appointment, which is a virtual visit where you can talk to your doctor via a video chat.
And if you're relatively healthy, you might think that you don't need to see your doctor on a regular basis. How important is it to check in with your primary care doctor at least once a year?
That's a great question. Even if you have no acute medical issues or any chronic medical conditions, it's still important to check in with your doctor for an annual exam. And the reason why is they can go over any preventative testing that might still be necessary for your age group. They can also review your diet, your exercise routine, and just make sure that you're living a healthy lifestyle.
Any final thoughts, doctor?
Yeah, so the bottom line is any doctor that you choose, you want to make sure that you can have an open and honest relationship with them. It's very important to be forthcoming with any medical issues you might have, any personal concerns. This is the best way that we can treat you and help to prevent certain chronic diseases from taking hold in the first place.
Doctor, thanks so much for taking the time to be with us. We really appreciate it.
Of course, thank you for having me.
So Scripps has primary care doctors at 25 locations around San Diego County. To schedule a visit with a primary care doctor, just call 1-800-SCRIPPS or go to scripps.org. Want more information about primary care physicians? Please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.